everything works perfectly. So let's see. Jacob.
There we are.
Hey!
There we are. How are
I
you?
can hear you. This is awesome. It never works the first time.
Well, I've like got this insane situation going on here on my desk where like I've got my headphones all set up, but then like I'm like all set up here to make sure that this thing works perfectly because I'm like in a freaking cave back here.
I love it. I'm so excited. Well, hi.
It's good to talk to you. I haven't talked to you in what? It's been some months.
It's been like a year, I want to say.
Yeah, it's been a long time.
Still follow everything that you do. I love it. You're super posting just really good, clean, easy to follow content, very clear for people to be able to see. So I love it.
Thank you. You too. So
Thank you.
yeah, you've been busy with the mobility method and the optimal body and the challenges and everything else.
Doing a lot, just trying to get the word out, help people just like you.
There you go.
So guys, I just added Jacob's link at the bottom so you can screenshot it and go back to it later, or just click the link in his bio. It's probably easier, but
Probably.
we'll talk about what that link has later. And I really want to just like get questions from people because I feel like people are going to have tons of questions for us.
Sure.
But first of all, let's say how we know each other.
Sure. So we originally met through, I guess, the myodetox kind of system. That was probably what we were like a couple years ago. Up in Toronto was the first time we met.
Yeah.
So
it's been a while, but we've been luckily connected outside of that as well. And you're killing it. You're doing how many workshops a year now?
So I'm doing 17 this year.
Whoa, 17 workshops. What do people do when they come to your workshops?
So whenever you come, so it's 2 days, and the first day is all like our injury prevention, risk reduction side of things. So the Prehab side of things. So the company and the seminars are called Prehab 101. Just to give you you get a lot of practical takeaways on what is actually going to keep you healthy. Because like, as we all know, like there's just so much freaking information out there online now, not all good. So my goal was to like streamline this. What does the evidence say? What's a straightforward approach to this? Which is kind of what my content's all about. The second day is we kind of flip it and say like, what happens whenever like you're actually dealing with someone who's already hurt? So rehab. So we do a kind of a prehab day and a rehab day, and work through kind of this whole rebuilding function, get you back to the life you actually want to live.
That's awesome. So is this more for clinicians or just everyday people?
So for the most part, it's for health and fitness professionals, or students. We open up the first day to the general public because we feel like everyone should have that kind of information available to them as well. But we kind of close off that second day just to the professionals, just because we kind of get into some higher level topics that you need some background for.
Yeah. That's smart. Awesome. So first of all, you kind of said something that I thought was interesting, and I kind of want to ask you about. How do people go about filtering out information?
That's a loaded question.
Yeah, exactly.
So
it is everywhere now.
It is. I think that you really have to get really good with your critical thinking skills. Like, really good. Because anyone can be an expert online. I mean, if I couldn't show you the piece of paper, I could still just put doctor right in front of my name, and it just say, oh yeah, I am. I'm a doctor. Listen to me. Luckily, I can show you the piece of paper that shows that I did my schooling. I can actually show you that. But, even then, it doesn't mean anything. Like, it doesn't mean that you're putting out the right stuff. So you have to learn to think a bit. A lot of times I feel like if it sounds too...
Oh, no, you froze. Come back.
So,
you froze for a hot second.
Yeah, I got one of those Amber Alert things right on my phone, like right then as I was saying that. So we're back though.
Okay, we're back.
So critical thinking. So if it sounds like this is the magical cure to it, it's probably wrong. right? If it seems like it's crazy, crazy complex, it's probably not that complex. You know, everything kind of lives in the middle, and the more you throw yourself to an extreme, the more likely you're wrong. So just really realize like things are going to take work, but things aren't so crazy complex that it seems like I'm the only one who has the answer for it. You know, if I'm trying to tell you, like if I'm trying to tell you why your big toe is the reason that your shoulder and neck hurt, like I'm full of crap. You know, it's just not, it doesn't work that way. But also if I'm trying to say like, oh, well, this is the one stretch that you need to do that's going to solve everything for you, also wrong. So you got to learn to weigh that there's no good or bad. There's no yes or no, and there's no black and white. You know, like trust the people who live in the shades of gray.
Oh, that's powerful. And I think that's really hard for people to do because we all, for everything across the board, what is the one diet? What is the one exercise? What is the one thing? Well, I have low back pain, so tell me the exercise program for low back pain.
Right.
Which isn't just one.
I mean, for me, it's like principles over protocols, because protocols suck. You know, like protocols are made for a very specific population or a very specific person, and they don't tell you what might work for you. Maybe they will, but maybe they won't. Yeah. But if you can start to like pick out principles under why a lot of these things work, then you can come up with a million protocols. You know, and that's where you really should be diving into things, is like, why does this work? Not just how does this work?
Yeah, 100%. I couldn't agree more. I mean, and I think that's the hard thing, and I hope people are really listening to this and really get that and understand that there's no one size fits all. There's no like, here's what you do day 1 through day 30 for a rehab program, unless you've been evaluated and that is specifically for you.
Right.
So how do you go about then to teach those kinds of techniques within your courses?
So I try and teach the underlying principles. I come in straight up and I'm just going to tell people, like, I'm not here to teach you anything fancy. Like, I am not there to try and say, like, this is my system, this is the way that, you know, this is the technique. You know, I want to teach you, like, how do you actually apply a million techniques, and like, what do they all do? What do they all have in common? You know, because like, let's take soft tissue therapy, massage, foam rolling, myofascial release. Let's throw adjustments into that. They all make you feel better.
Yes.
Like, that's like their mechanism. They make you feel better. And they are there to make the process easier and make you feel better along the process. But, you know, they don't make you stronger. They don't help you handle picking that thing up. You know, they're not going to make you magically be able to go and lift weights again. They're not going to make you just magically go run again. They make you feel better, but they tend to be temporary.
Yeah.
You know, so they kind of fit into a particular box. You know, and then you can just pick out any tool you want based on what does this person believe works best for them, or what do they want the most. So you learn how to pick things out of boxes. That's what I try and teach. I try and teach people, like, these are the boxes.
Yeah.
Fit whatever you want inside of that.
Yeah. Okay, so you tapped on something else I want to dive into for a second.
Okay.
You're a chiropractor.
That I am.
Do you use adjustments?
I do.
Okay.
Yeah.
And
so I use adjustments. I will say that I use adjustments probably only like 3 to 5 times a month, though, because it tends to be more so that my patient asks me for it than anything else. So that box that I throw that stuff into, I call it symptom modification. It's just there to make things easier, right? So if we really, like, depending on how deep down the rabbit hole we want to go with that.
Let's go deep.
All right. So so here's my whole
need education on this. I've been trying to talk about it, but I'm a PT, you know, so they don't listen to me.
Right. Right. So here's my whole theory on this. Sorry, I have like comments covering my face here. So there we go. All right. So here's my whole theory on this. If we're doing soft tissue or chiro or adjusting, whatever you want to call it, then we are in some way affecting the nervous system, right? So we're making someone less sensitive. Well, my goal is to get you out of my office. I want you doing some sort of home exercise program. So with that, I want to find the exercises that are most appropriate for you, your current pain tolerance, etc. I'm not going to be there with you at home. So if I am going to find the best exercise progression for you, I do that on what I call a cold nervous system. I need your nervous system to be cold. I need it to be fresh. I need it to be not tampered with. So if I'm going to do any type of passive therapy, I do it last. So we always try and find the active symptom modifications. So the stuff that you can do on your own at home first, whether that could be like a postural change, or moving in a little different way, or doing this little stretch here first. Whatever that is, you can do that without me. You can do that at home. So we try and find those things first. Then we find the exercise progressions that we want you to use, and we put you through those. A lot of times, that's all you need. So if then someone's like, hey, you know what, we got all that in place, hey, do you mind, like, can I get a little extra? Can I get that, the cherry on top? I'm like, yeah, sure. Like, let's do that. But my thing is, like, it's like my thing on being evidence-based practice and all this is it's not about the therapy you use. It's about why you're using it and what you're telling someone it does. Because I can tell you that squats are really good to strengthen your knees. Totally evidence-based. But if I tell you that you can jump off the roof and fly after doing them, not so much. If I tell you that chiro is going to make you feel better and just help you along in the process, pretty evidence-based. But if I tell you that it's realigning your spine, not so much, right? So it's more about the narrative that you're forming around it than it is about the therapy you're using. After that, you just figure out where do you personally feel it fits best into the whole plan.
Yeah. Huge. I hope everyone just heard that last line too. It's not realigning the spine.
Yeah, not really.
I had someone tell me that the difference between the manipulation that a physical therapist uses and the adjustment is that the manipulation is only for the nervous system, where the adjustment is actually aligning the spine.
It's the torque. That's what it is.
Hand use for that one, right?
Yeah, it's the specific technique where you set up like this and you spin the bone. Oh. You spin the bone. Don't mind the frictionless surface of the fascia. We don't think about that. You just take up the tissue slack. Then you can spin the bone under the skin. That's how you change the nerve flow. Oh. So, this is the problem that we have is like you say like, oh, you know what, soft tissue therapy doesn't break up adhesions. It doesn't break up scar tissue. And then the next person's like, yeah, but you didn't do it with my technique. Yeah. Oh, we can't feel those restrictions. We can't, well, you weren't trained the way I was trained. Mm-hmm. It's like, this is the problem with techniques. Yeah. Is everyone thinks theirs is better and they think that they have the system. And this is why I don't care for them. I'm just like, no. Like, they all kind of work along the same mechanisms. Just figure out what works best for your person.
Totally, 100%. This is massive. Already getting into the good stuff first 15 minutes.
Yeah.
Where was I going to go with that after? Okay, so you have 3 things that you feel are the best that everyone should kind of be paying attention to, integrating to really assess injury prevention. Because at the root of it, we can't necessarily prevent injury.
Right.
It's going to happen. Pain's going to happen. My thing is, like, I don't want to make people afraid of it. It's just some place we get to listen to and say, okay, what gets to change now? Sure. But what are the 3 things that you think people should start to pay attention to and increase their awareness?
Right. So, well, I'll actually give you 4 because just saying that kind of brought something to mind that I wasn't thinking about earlier, which is the first step to reducing injury risk is realizing not everything is an injury. Okay, so we've all probably been sore after a workout. Okay, that on some level is an indicator that you've done some sort of tissue damage to your body, right? But you don't consider yourself injured when you're sore. I mean, it might be determined by like how high the stairs were that next day, but you're not injured.
Yeah.
Because injury has something else to it. I say, like, the way I like to describe injury is it's a product of either the functional or psychological limitation that might be associated with damage. So that might is big too, because you can obviously hurt with no damage to your body. You can have damage with no pain at all. Like, I think it's like 23% of people that have no shoulder pain have rotator cuff tears. Like it's there.
Yeah.
And you don't have to be limited by that. And when we look into the literature, it's the way they tend to define injury is like things that make you actually miss time, miss like games, miss practice. So it's the limitation that more defines that. So the first step is realize, hey, you know what? Not everything is an injury. That random ache that you feel doesn't mean something has to be wrong. Sometimes like pain is just a part of the human experience. So learn to be okay with it every now and again. Yeah. Now what we're really trying to reduce the risk of is the big bad stuff, right? The big stuff that's going to limit us.
Yeah.
So with that, there are 3 things that I feel go into the injury equation, or what I call the damage equation. So we could say that damage to the body is going to happen when stress is greater than capacity. Capacity being how much can you physically take, stress being how much you're going to apply. So stress to me comes from a pattern, basically the way you move, because that's going to bias a tissue. If I raise my arm, certain pattern biases my shoulder. And a load, sets, reps, weight, time, distance, speed, whatever, quantifiable factor. So that kind of gives us 3 things to focus on there. Pattern, or movement, load, and capacity, all right? So those are kind of the 3 things that if we manage those things, we can do really well. So if we look at things like traumatic injuries, I like to get people laughing. I say you get clipped by a bus. That's the example I use in the seminars. Is like if you're clipped by a bus. So, there's a funny story behind that, because I went to University of Texas and we had a kid who actually got hit by a bus during one of our we have this like giant foam sword fight at the end of every semester. So like the students stand on the either side of the street, and when the crosswalk goes, they run into the middle of the street and fight each other with foam swords. We're super prestigious. Oh. Anyway, somebody stepped out a little early, and boom, he's over here. It's on YouTube. You guys can look for it. You can look for it later. He was fine. I'll preface that. He was fine. Good. That's important to know. Yes, but anyway, when that happens, you're not in control of the pattern, right? The bus did that. You're not in control of the load. The bus got that. All you had was your capacity. Were you physically able to take the blow? Now take that to a linebacker barreling into your knee. You're not in control of the way your knee goes, the load applied. All you have is the capacity. Can you take it? And this is really why these traumatic injuries are almost impossible to stop, right? Now, then we look at like the non-contact kind of acute injury, stepping wrong, landing wrong, whatever. You have control of the way you move, right? But you don't necessarily have control of the load as much. That's more like your body weight, your speed that you're going, whatever, and you have your capacity. So a little bit more preventable, but we're still not in total control. And when we look at things like the ACL rehab programs or a lot of these proprioceptive-based rehab programs, they're built around strength training, increasing capacity, and they're built around helping you move a little bit better, right? So you kind of avoid the dangerous positions. And really that's kind of what it's breaking down. And then when you get to the situations like the overuse injuries, you're in control of all of it. And that's the stuff that we can really take care of, you know, the tendinitis, you know, the muscle strains, that kind of stuff. We can take care of that stuff. So that leads me into the 3 things that you should be focused on. The first one, and this is kind of the base of my pyramid, is load management. So handle the loads that you are applying to your body. Are you ready for that? Have you prepared yourself for that? You know, are you jumping into the gym day 1 and going as hard as you can? Probably not the best idea.
Yeah.
So
if you, like that applies to even running. Like say you
right, anything.
run and then you go run like 10 miles. Probably not the smartest thing.
Exactly. So when we look into the literature, like what kind of has some of the best research behind it right now, it's the acute to chronic workload ratios, Tim Gabbett's work. And where he would say, like, take the average of what you do this week, divide that by the average of what you've done over the last 4 weeks. And you're looking for that number to be somewhere between about 0.8 to 1.3. So 1 being you're doing exactly the same thing that you've done over the last month. You're prepared for it. Mm-hmm. But if you're doing twice as much now as you've done over the last month, you're at a higher risk of injury.
Yeah.
Okay? Now, think about that with things like, when do you get the most sore in the gym? It's when things are new, right? It's the time after a layoff. So we combine that with like what we call the repeated bout effect, which is the more you do something, the more adapted you get to it, the less damage your body takes from it. All this kind of tells us, like, you know, when are you most susceptible to things? It's when your bottom number, that chronic workload, what you're prepared for, is 0. Mm-hmm. It's when things are new and you don't have a buffer built.
Yeah.
So you need to build yourself a little bit of a buffer over time towards these things. So if you're going to jump in and start running, you don't jump in and start trying to do the 5K or the 10K in week 1. You walk and run. You do whatever you can. You know, you work up to, hey, you know what, this was hard, but I didn't kill myself today. You know, if we were going to give like a level of effort to that, work up to a 7 out of 10 in that first week. Gradually ramp that up over 3 to 4 weeks to, okay, now I feel like I'm really pushing myself. You know, and you can get really deep into that with tracking a ton of variables, but that's kind of the main gist of it, which is starting out, anytime you add something new, keep it to like a 7 out of 10 effort or difficulty, and then gradually ramp your way up over 3 to 4 weeks. That's going to be some really practical load management, and that should be kind of the base of your pyramid when it comes to prehab.
Yeah.
So the next piece on top of that then, if we got the load, then, and which in turn is also affecting capacity over time too, because you're going to get better, you're building that buffer. So then we can look at movement. How do you move? Now I use a term called movement efficiency, because, you know, like everyone's kind of talking like there's no good or bad movement now.
Yeah.
So I use this term efficiency because efficiency means maximum productivity with minimal wasted effort.
Yeah, I say that a lot too. It's not about what's good or bad. It's what's more effective and efficient within the body.
Right.
Yeah.
Exactly. So if you drop a pin and you need to pick up that pin, do you need to go through your full deadlift setup to get that? Hell no.
Yes.
Yeah, right. Sorry. Brace the core, straight spine, neutral all the time. But, you know, if you're going to go pick up a 400-pound barbell, should you just bend over lackadaisically, not caring about a thing in the world, and do it? No. Like you need to give more productivity, right? You need more effort to do that. So you need to kind of put yourself in control of the pattern as much as you can when you need to. So with that comes, can you control your movement? And do you have the mobility to be in that position? Because if you don't have the mobility to be there, you're going to then have to compensate around it some way, right? So you don't have control of the movement anymore. And then if you do have the position, well, then can you actually put yourself where you want to put yourself? You know, do you have that motor control? So those two components together go into move well.
Yeah.
Right? You know, and there's gray zones in there. There's wiggle room in there, because, you know, the best movement's probably the one that gets the task done while you still being comfortable. and doesn't look like god awful. You know, like if it looks like, oh, please don't ever do that again, we should probably fix something.
Yeah.
You know, but if someone's just like, you know, if it's like a little bit off, it's not textbook perfect, that's probably okay.
Yeah.
You know, we're adaptable creatures, and we're probably going to be okay with that.
Yes.
Last piece on top of that is recovery. So recovery is like the thing that allows all the rest of this to happen. So you can't actually build your capacity up if you don't actually recover from the stresses that you apply. So when we look at recovery, we can break that down into what we call subjective or objective. So subjective being things that just make you feel better. Objective being like it creates real physical change in your body. And that's the stuff that we know we should be doing. So objective is your sleep, your nutrition, your hydration, managing your psychological stress. You know, it's resting. That's the kind of stuff that actually makes real physical change in your body. You need that stuff. And you have to get your ducks in a row with that.
Yeah.
But we kind of, you know, we live in a society where we don't sleep enough, we're overstressed, we don't eat that great, you know, and we got to take care of that.
Yeah.
You know, because it has real repercussions if we don't. On the subjective side, that's just more like, hey, what feels good? What makes you feel good? Is it hitting, you know, do you need to foam roll a bit before you work out? You know, is it going for that walk? Is it, you know, just moving around, getting the blood flowing, whatever? But that stuff isn't necessarily going to create real recovery. Like your tissues aren't fit. It's not going to make your tissues heal, you know? So prioritize objective over subjective. And that's going to be, couple that with then move well when you need to move well, and then manage the load on top of all that, and you should be doing pretty good.
Yeah. I mean, and that could be a bit overwhelming, especially when, in terms of people figuring out how to move well,
right,
is a hard thing, because like you said in the very beginning, we have a bunch of fitness people now posting on Instagram and social media who have no credentials, not even for personal training. They look aesthetically pleasing, and they're putting their take on their workouts, which might not be the most efficient way to load someone else's body in those
right
workouts.
And you know, I think the thing that I see more often than not with those kind of things is kind of being a little too hyper vigilant on the this is bad side of things. So I think it almost makes people stress a little too much. So, you know, if you're going to lean one way or the other, I would rather lean towards being a little hyper vigilant on things.
Yeah.
But like, it's okay to not move perfectly.
Yeah.
Too. You honestly probably can't move perfectly. So a lot of that stuff, I'm just like, really? Like, we're really going to say that? We're really going to sit here and like say that, you know, oh, like have your elbow here and that's going to hurt you, but have it here and it's going to be all good. And I'm like, okay, whatever. Because it totally ignores every other piece, right? Like we just took what we call a 4-factor equation, damage, pattern, load, capacity, and we're going to pull out one little piece of that pattern and say, oh, there's the thing.
Yeah.
Ignore the rest.
Yeah.
You know? So if you understand like that equation, to me, like that should be the base of your critical thinking when it comes to evaluating what everyone's saying around here.
Yeah. And we have to also look at the body as a whole. Like you said, those objective pieces, they play a role into pain, injury, and it's huge. I mean, I, for one, know for a fact a lot of the people that you should have Dag and I on right now. Okay, ignore Anders. God, Anders, you messed up my train of thought right now. Oh, for me, one of the things that I like go over a lot with people is what is going on objectively in their lives. Like, what are those pieces that they can control? How are they eating? What is happening in their stress and in their life? Because that all plays into a fact of, like, we can continue to try to increase mobility, but unless we deal with the stress, the sleep, and all this other stuff, it's probably not going to change.
Right. Because all that stuff can kind of, I say kind of anchors your pain tolerance a little bit, you know, like whenever you're chronically stressed, like you're just more prone to hurting.
Oh.
You're more prone to aching, you know. Whenever you're sick, your whole body can kind of ache. Other people like to describe that as, you know, everything is a load that you have to deal with. You know, it's not just the physical, but it's the psychological, it's the emotional, it's all of it.
Yeah.
So however you want to think about it, however you want to see it, just realize like it all plays a role, and it's all going to be something that you need to deal with, because sometimes, like, I've seen people who literally aren't very active and hurt. You know, it's not all about just the physical stresses you're applying. Sometimes you got to get that other stuff in play as well. And that's down to, you know, treat the person, not the pathology.
Yes. And look at your body as a whole.
Right. Always look at the body as a whole.
A lot of people like to, you know, just because you have a pain point someplace doesn't mean we only go to that one place. If we're not looking at the body as a system, we're missing an entire piece, which is a lot of the reason why I'm sure you get these questions as well. It's like, well, this is hurting. This is hurting. What do I do for my back? Give me back stretches because my back is in pain. Where it doesn't work like that. Right.
And especially when you start seeing like my elbow hurts, my knee hurts, my back hurts, like you're starting to see that there are all these things going on. You're like, man, you sound like you have a systemic problem. Like we need to dive in deeper here. And then the other thing is, like, if you can't necessarily recollect like what could have caused this, like you need to look system wide. You got to look systemic, right? And you got to get sometimes you need a whole lifestyle change to get past some things. And that's scary at times for people. It doesn't have to be. You just got to take it step by step, and you got to realize that it is a long game. It is something that's going to require work. And the quicker that you accept that, the quicker that you can learn to, like, baby steps add up to miles when you just keep taking them.
And that applies anywhere in life. Anything that we want to do, anything we want to create, no matter what it is, it takes work. It takes action. So I don't know why we assume our bodies are going to be different. Like, you assume you're going to lay on your table, get rubbed out, or get cracked, or whatever it may be, and all of a sudden everything's going to fall back into place. It just doesn't work like that. It takes work. It takes action to actually move into your body and create change.
Right. Yeah, you got to put in the work, and you got to be ready to do that.
Yeah.
You know, like, you don't get fit in a week, right? Like it's
watching.
Yeah. It doesn't work that way. You gotta have consistent progress. But this is a societal problem. Like, 30-day fat loss, like the thing that's going to get you in shape in 2 weeks, whatever, and if we had physio magazines, in the grocery store, they'd say like, rid your tendinitis in 3 simple steps, and, low back pain fixed in 24 hours, whatever. Like, it's the same mindset that we create about everything. We create a quick fix mindset. And we're out here trying to kind of get people away from that quick fix mindset.
Yeah.
I mean, that's where I say, like, if you guys are only watching the videos, you're missing a big piece. Like, get down there and read the stuff we put under it, because that's where that's where at least my very thoughtful stuff goes into this. And I know yours does too, because I read them.
Like huge long
yeah, like I run out of text daily.
Yeah.
If you want to know everything I teach in my seminar, go read every caption I've ever posted. I don't hold anything back for you. So, that's the first step to all this is like acceptance.
Yeah.
You just got to accept, like, there's ups and downs, and it's not a straight line, and good days, bad days. It's a rocky road, but just be in it for the long haul.
Such is life.
Such is life.
That is life. And the easier that we can just come into acceptance with literally everything. Like, this is just a metaphor for everything. The sooner we accept, the less stress that we have. Like, I accept I live in LA and I'm going to hit traffic.
Right.
This is full acceptance, so that when I get in the car, I'm not angry, I'm not upset, I'm not stressed. Full acceptance.
So I think it was like a year and a half ago, back when I did more than just videos, I actually did some graphics too. I put up this like flow chart, and the flow chart basically said like, I don't know, it was like, can you control, it was like you approach a situation, can you control it? And if the answer was no, it's like, well, then don't worry about it. If the answer is yes, well, then don't worry about it. Just control it.
Yeah.
And that's really like, that is like my mantra for life, which is you just step back objectively and you just ask yourself like, hey, can I control what's going on right now? Yes or no? If I can, then I'm going to take the steps to do that. If I can't, then I'm going to either accept that and not worry about it, or I'm going to start to figure out what's the next step do I need to take to help myself along the way. And that goes to people who are looking for help here on social media. Can you help yourself? Can you take the stuff that we're putting up and help yourself? If you can't, you got to take that next step, and that next step should be getting someone to actually take a look at you. Yes. Figure it out. That's what we all kind of went to school for. That's what we all have our specialties for. I Google things whenever I can't figure out something on my computer. Yeah. But eventually, I have to go take it in every now and again whenever I can't figure it out. Yeah. And it's the same thing with everything. We Google everything to try and figure it out. And what we're doing here is we're just meeting people in their own reality. We're trying to put out the good information because we accept that people are going to look for it anyway. So we're trying to at least guide you down the right path. But if it's not working, like, just get out and go see somebody.
Exactly.
Like, get that help.
Exactly. I mean, it's the same. Like, I use this example of, I know how to dress myself in workout gear, but outside of that, so if I go do presentations or go to events, like, I'm like lost. So I hired a stylist. Like, it was a big step for me. It was expensive. It's not something I do on a regular at all. But I also know I don't know that area. So why don't I go get help? It's the same thing. Like, we're not expecting you to sit here and know everything about your body.
Right.
We're saying, here's some tools. If these tools are still not helping you, go learn more tools in person. So go to your seminars, or go see you in person, or go to your local physical therapist. There's tools all around us, and this body is worth paying for.
Right. Exactly. And you just gotta, value yourself. Obviously, there's limitations to that. There's people that are not in the same situations. So, we try and help everyone we can. That's another big reason we're out here. But like, really, really take control where you can take control. And part of that is going to be really realizing that, like, you can do this and you can put in the work on it. You can get there. Yeah. Yeah. So.
Totally. 100%. I agree. Okay. Let's take some questions for the
last
few minutes. Getting a lot of amens and people liking it. I love it.
That's always good.
If you guys missed any of this, go back to the very beginning.
Yeah, there's no way we're going to be able to scroll all the way through all these comments, so throw questions in now, and we'll start reading.
Yeah, exactly, exactly. Well, there's one that, because you were talking about, the difference between picking up a pen or doing a deadlift. Would a PT, for an average person who's not going to go out and lift, still need to teach a hip hinge?
I think that everyone probably should, and here's my reasoning. So I think everyone needs to be able to pick up a 30-pound kettlebell, because kids eventually weigh 30 pounds.
You have one yourself.
I do have one myself, yes. 8 months old, and he is all over the place. And that's another thing. Kids don't exactly stay next to you in perfect biomechanics. So I think that you should. Yeah, I think everyone should at least know how to hip hinge. You should know how to pick something up that way. Just like, it's another position. It's more variability. Yeah. Right? You may not necessarily need to progress your way all the way up to, a 200-pound deadlift, right? But you should at least be able to pick up your kids. You should be able to move your couch. You should get yourself to the point that life cannot hurt you. If you're happy there, I'm happy there too.
And you should be able to get on the floor with your kids.
Yeah.
And spend time there. So
move. Move around.
Yes. So if you're having trouble getting down on the ground, staying there for periods of time and getting back up, also a problem.
Right. Right. All right. What's next? What we got here? Okay.
All right.
Dun, dun, dun. Year 1 DPT student right now. Any tips making it out alive? Study, sleep where you can. Coffee.
I
Coffee.
started competing in calisthenics. I learned acro yoga in grad school. Just
there you go.
pass.
I got up early and hit the gym so that I could study in the afternoons.
I got more fit in grad school actually. So
yeah.
My advice is study, have groups, but don't stress yourself out. Literally no one's gonna look if you get valedictorian. I know this might be bad advice, but no one freaking cares. Just learn the information, pass, and continue to learn the information because
you all get the same title.
Yes.
If you miss a couple classes to go out and take a seminar, probably not the worst thing in the world.
Oh, I wish
I
would have done that as a student. I meet so many students as PTs and DCs who are students and they're taking the same courses I'm taking, and I'm like, you're so smart.
Right. Yeah. I wish I would have taken more too.
The boards have to. They're national, so they're not going to change with the information that's changing. So know that you're going to learn how to look for red flags, learn how to not kill someone, know some good.
Ideally.
Hopefully know when to refer back to an MD, but you're also not probably going to learn the exact tools that you need to actually help someone progress. So continue learning.
Right. All right. Next question. Advice for overstretched or irritated hamstrings. You're the flexy one here. What do you recommend?
Overstretched hamstrings? It always that's a depends. What is overstretched and for what population? If I'm talking Cirque du Soleil, they need really a lot of flexibility. So as long as you can control that in the end range of motion and you have strength in that end range, it's overstretched meaning it's only passive and I can only lift it, but I can't control anything within that range, then that's when it becomes a problem. But if you can actually be strong and be pliable and stable within your full range of motion, then I would say it's not overstretched.
That's what you teach in the mobility method, right? Active control, active mobility. It's not just passive stuff, right?
Both.
Okay, cool.
Both. So it depends. Where are you? Do you need passive first and then active?
Gotcha.
And then there's a lot of active stuff. So
sweet.
Both. So
I'm a meathead, so I'll flex my bias here and say strength is probably work it.
Yeah.
I really love the Romanian deadlift and the straight leg deadlift here in these situations. I think that they are they're probably the best exercise for that situation. To where, let's say that you reach a point through a hip hinge that things start to feel a little irritated, it feels like it's oh, there's my point. Yeah. Just stop right before that and then come back up. Do it. You do 15, 20 reps of that, it's going to be surprising how much you can kind of sink into that.
Yeah.
But so kind of find the edge of your pain tolerance, and this kind of goes with everything. You kind of find the edge of your pain tolerance, you flirt on the edge of it a bit, and then you progressively get yourself a little bit further. But you kind of have to let yourself know that it's there. You need to show your body that, you know what, hey, it's okay that I went to the edge of that pain tolerance. You don't, it's okay to poke the bear a little bit, and you just want to make sure you're not just going way, way into it. Yeah. Don't go too far. Again, what I say earlier, load management. Yeah. Don't do too much too soon. So the same principles that I'll use for risk reduction of injury is the same thing I'm going to use for management of that injury. It's just I switch the thought from now I'm not really focused on the tissue as much as I am focused on the nervous system and the brain and just how sensitive things are. So I say work it. I say work yourself right to the edge of that pain tolerance, move something a little heavy there, do it more than once, and gradually push it a bit.
Very smart.
AKA do deadlifts. All right. You get to pick the next one.
All right. And there's a lot of pain things or diagnoses. We can't, unless we can assess you, I don't really want to get into that too much.
We're scrolling here.
What led each of you to leave regular outpatient and pursue niche practices or work independently? Are you working independently? Yes, you are.
Mm-hmm.
Right? Yeah.
Mm-hmm. Yeah. I started that way. So I knew day one in school I wanted to go and have my own practice. That was just always a goal, because part of my motivation of going to school was to be able to give a better answer than just don't do that. Like, I saw so many people that would get injuries with lifting and they would just be told, well, just don't run again, just don't deadlift again, just don't squat again, whatever. And while that's good advice up front, it's like, yeah, but do what instead?
Yeah.
Or when do I get back to that? Yeah. Or like, how do I get back to that? Because this is what's important to me.
Exactly.
And I hated the cop-out answers. So that is really a big part of what led me down that path, which was I wanted to up the standard a bit. And so I went into private practice straight out of school with my wife, Monica. She's also a chiro, and been doing that ever since. So I never really left the nice job. I just never really had the nice job. I struggled from day one.
But I would say you've created a practice that's very different than your typical chiropractic clinic. Clearly, your first step is not even putting people on the table, it's getting them to move.
Right. I'm 100% fulfilled in what I'm doing. Yeah. Which is what matters to me.
That's amazing. That's amazing. For me, I did go into a typical clinic for about a year and a half, and it was just, you're never going to be able to help someone the way that I wanted to help. First of all, a lot of people were coming in because either it was a car accident and they need to win the case. Insurance was just paying, so why not come 3 times a week? Even though that was not necessary. A lot of the people wanted the ultrasound, wanted the electrical stimulation, and not that these are bad. It's just not where I'm gonna, first of all, I don't use any of those anymore. And it's not necessary to.
Yeah, it's that passive approach, that cherry on top that we were talking about earlier.
And there's so much turnover that you have to put them with an aide who, bless their hearts, don't know anything about working out or exercise. And so I wasn't able to treat people the way I wanted to. Not enough time to really connect, not enough time to go and dive in to see what was actually the problem. Insurance controlled a lot of what we charted in terms of, well, I'm going to prove that this is the injury, so I'm going to do all these metrics around it, even though probably we'll throw those out later and look at the body as a whole.
Right.
So there was a lot that, for me, I just wasn't fulfilled. And about a year and a half after I started practicing, I took a leap of faith, knowing that I have a career and I can always come back to it if I needed to. And I've been on my own ever since.
Gotcha.
All right. This is already on 50 minutes, so we're...
All right, so we got 10 minutes left?
Yep.
All right. Because life often requires sloppy, imperfect movement, how important is it for patients to be able to lift loads in lumbar flexed, rotated positions? How important is it to get people comfortable with that?
That's a good question.
That's a good question. So Ryan DeBell and I did an entire podcast on this last week.
Oh, nice. Love him.
Yeah. So my opinion there is you should be comfortable with it. You should, and this is what we call kind of movement variability. You should be able to move in variable ways and be exposed to those things. But there's probably a top end to how much you need there versus say because like I said earlier, you kind of want to bulletproof yourself against life.
Yeah.
Right? So I think that everyone should be able to deadlift the amount of like their couch.
Yeah.
Like pick up whatever life is going to require you to pick up. At some point, you know, like if you approach something really, really, really heavy, are you going to come in a fully flexed and rotated lumbar spine position and just try and lackadaisically pick that up? Probably not. You're probably going to be, something's going to click in your head and be like, you know what, maybe I should use that hip hinge right here. Maybe I should use that, you know, that deadlift thing that I've been practicing there. So, but like you randomly are just going to reach for something and just pick it up, right? So you should be exposed to that. I think everyone should be able to do that. I just don't think you need to have as much of a top-end ceiling to it as you do with more of your like traditional training stuff.
What do you mean by that?
So like I just don't think you need to build, I don't think you need to do a 200-pound Jefferson curl. Like I don't think that there's any point to that, because at some point you're probably not going to be lifting anything that heavy in life in that position. So like build as much capacity in those positions as you actually need to, but beyond that, like, you know, you probably need to be able to do more with that straight spine position, just because you're probably, that's how you're probably going to lift a lot of the heavier stuff in life anyway.
What about those, what is it, the Chinese lifters?
Sure. Well, okay, well, now we're talking competitive sports.
Yeah.
Competitive sports is a different ball game, right?
True.
So high load means high capacity. You better have it. And whenever they want to throw that amount of weight over their head, they better be ready for it. But like, does my grandmother need to train the way the Chinese weightlifting team does?
No.
No. Right? No.
Not.
Right.
Yeah.
So this is back to treat the person.
Yes. And I feel like also, like, yes, it's amazing to hip hinge, but it's also amazing to move the spine. So teaching people how to do everything across the board in terms of, well, not everything. I mean, obviously within what your goal is and what you're trying to create within the body specifically for that person. But also it's, you know, we don't ever want to make anything seem fearful or bad, because that's where things become, that's where they get carried out in the wrong way. Like I've had someone come to me and said, well, I can't remember what the injury was, so I can't load my spine. And I'm like, well, then you better not get out of bed, because you're going to load the spine. Like we say these things, and we need to be very careful with what we're saying, because that's not actually, our body is so resilient, it's so strong. So teaching it and allowing it to move in different directions, like I'm sitting in flexion in my low back and I'm fine. So also teaching the body how to be able to tolerate these different positions and not put it out there that they're scary and you need to be, you know, you can never flex your spine if you have a disc injury. Like we need to start using better language to allow people to feel safe and comfortable no matter what they're doing. Yeah,
you know, and I think like words matter, but understanding matters more. So both matter, right? Both matter, absolutely. So I think sometimes we take for granted our background knowledge. So if I was to tell you have some wear and tear in your body, like it's not going to destroy your psyche. If I tell you have a disc herniation in your back, that's not going to destroy your psyche.
Right.
But you know what it means.
Yes.
You know what it means to the rest of your life. You know that it means you don't have to be limited forever, right? So I can say these words to you. I can use those words, but it's because you have a certain level of understanding as to what those words mean.
Yes.
And I think a lot of times where we actually miss out is we just say the words, but we don't explain.
Yes.
You know,
why behind
like
everything is so important.
Exactly. So we don't give people the explanation of like, what does that actually mean for me? So I have no problem telling my patients, hey, you have a disc herniation in your back. Like straight up, you're an adult. I'm going to tell you this, but here's what it means.
Yeah.
Like it's going to, like, you're going to be okay.
Yeah.
Because you know what? Like this percentage of people in your age group also have disc herniations and no pain. And you can be totally 100% functional and have no pain and have that disc herniation, because guess what? I have one too, and you can still perform at a high level. And we decrease a lot of the fear by the explanation that we give, right? And that's so huge.
Huge. But it's also like catching the language of like, well, my back is exploding right now.
Yeah. So there's the really bad, again, it's the really bad stuff. Like, I can totally be on board with like calling like chronic degenerative changes normal age changes. Like, I can totally be on board with that. But I think I saw something that was like, somebody said like we shouldn't call clinics because it nocebos people. We should call them like healthcare gymnasiums because it's more positive. I was just like, okay, like, I think we're taking this a little too far.
I think, and things are patient dependent. It always depends. Is your patient
it always
very
depends.
high, needs a lot of coaxing, it depends.
Most people are reasonable, but you have to be able to identify the people that you got to be a little more careful around.
But no one's going to continue to do your exercise program or do anything that you are telling them without understanding why they would need it within their body. So unless they feel it, unless they understand it, unless they get it, it ain't happening. So
better buy in.
Yes. And that's like, I've heard clinicians complain about that too before, where it's like, well, my patient, like, they just didn't do the exercise. Well, no. Let's turn that around and say you didn't explain it in terms of a person understanding why it would be important in their life in order for them to take that on. So we actually get to be responsible as clinicians to say why something is happening and why it's so important in someone's body.
Right. We have to give people reason to buy in. Yeah. And then on the flip side of that, you have to buy in. You got to be in it for that long game, like we were talking about. Yeah. You have to be ready to invest in yourself, and you have to be ready to work.
Yeah. And
that's probably the best way to end this.
Totally. And what he means by long game too is not that come 3 days a week for
yeah, no.
For like 12 weeks. Like, we're both trying to get you out in the world doing it, but you've got to continue it in your own life away from us.
Right. Very real. That's the best right there.
Amazing. Okay. So real quick, screenshot, go to this link, or just go follow Jacob, go to the link in his bio and sign up for one of his courses so you can learn all the things.
Please. We will have you. We're in DC in October, and we are in Miami in November. That'll be the last 2 for the year, and then we're getting ready for 2019.
Awesome. Well, Jacob, thank you so much for dropping so many knowledge bombs. I hope people go back and watch the whole thing. And thank you for always providing a huge space of resource for people to be able to learn from, move into their bodies, and, just move.
Thank you. No, I appreciate you letting me come on and just like spread the message a little bit. That's all I'm here for, is to try and create a little bit of clarity while getting people to see that this stuff is complex and there's some gray zones, but the straightforward approach is the best approach to it. So appreciate you letting me come on. It was amazing talking to you, and thank you to all of our 73 people who are still sitting in here.
I know. All right, well, have an amazing night. I appreciate you, and
you
tell
too.
Monica and the baby I say hi.
Will do. All right, see ya.
All right, bye. Hope you guys watch that all. Definitely click in, watch the whole thing. It's epic. He shared so many amazing things. And so I'll catch you guys